Behavioral Statement A says applying the Pharmacy Act, which is Act number 53 of 1974, the Medicines and Related Substance Control Act, which is Act number 101 of 1965, and any other applicable legislation in daily practice. So the reason why I divided this behavioral statement in different parts is so that you see that to comply with the requirements of Behavioral Statement A, you need to provide evidence for how you applied the Pharmacy Act, how you apply the Medicines and Related Substance Control Act, and any other applicable legislation in practice. What does applying the Pharmacy Act means? It means you must first understand the importance of complying to legal requirements and adhere to the standards set out in this act. So first know why. As pharmacists and interns, we must comply. It's just compliance. Number two is in the activity that you are doing, you need to incorporate the regulations and requirements that are outlined in the Pharmacy Act in that practice and in your daily practice. It also includes that we need to provide safe, effective, and ethical care to patients by following the guidelines. So it all depends with what activity you are doing, and then in that activity, incorporate the Pharmacy Act. So what is this act about? The act governs the pharmacy profession in South Africa. It outlines the regulatory framework for the practice of pharmacy, ensuring that pharmacists, as well as interns and other support personnel, adhere to high standards of professionalism and ethics. Ethics equals to code of conduct to ensure that the public is protected and is safe. It provides the legal framework for the practice of pharmacy, including the licensing and regulations of pharmacists and pharmacies. So you need to be practicing in a pharmacy that is approved. You also need to be registered. This is what the Act says. It outlines the standard for the practice and professional conduct required for pharmacists. So already you can see that the Pharmacy Act contains information on ethics and the code of conduct. It also specifies the qualifications and the trainings which are necessary to become a licensed pharmacist. So as you understand what the Act is about, in the activity that you're doing, you then have a basic understanding of what I need to be looking out for. Also in the same Behavioral Statement A, applying the Medicines and Related Substance Control Act, what does this mean for pharmacists? It means that we must incorporate the regulations and requirements outlined in this Act. We must always endeavor to regulate the control, the manufacture, the distribution, the sale, and the use of medicines and related substances, which could be surgical items. It ensures the availability and use of safe, efficacious, and quality medicines and medicines product in South Africa. So the Medicines and Related Substance Control Act regulates some of these things. So in the activity that you are doing, how are you applying the Pharmacy Act, the Medicines Act? So you need to be clear about the activity and then find out the laws that relate to that activity that you're doing. So the primary purpose of the Medicines and Related Substance Control Act is to ensure the safety, the efficacy, and quality of medicines and medicines product available in South Africa. It regulates the control, the manufacture, the distribution, the sale, and the use of medicines and related substances. It ensures that the medicines that we keep and distribute in South Africa are safe, effective, and of high quality before they can be marketed and sold. It defines the rules for prescribing and dispensing medicines, including scheduled substances. So as you then begin your activity, you will then find regulations that pertain to dispensing medicines. So if the activity that you're doing is dispensing, you need to find out what the Medicines and Related Substance Control Act says about dispensing and prescribing. So other applicable legislation include the Occupational Health and Safety Act, which is Act 85 of 1993. So the Occupational Health and Safety Act aims to ensure the health and safety of workers at workplaces and those affected by workplace activities, requiring employees and employers to provide a safe and healthy environment and take measures to prevent injury and disease. The other one is the National Health Act, which aims to establish a structured, uniform national health service which ensures access to healthcare services for everyone, and it outlines the responsibilities of different governing levels in providing healthcare. The last one being the Medical Schemes Act, The main purpose of this act is to protect the interest of beneficiaries of medical schemes. So it strives to be a fair custodian of equitable access to medical schemes, and in order to support the empowerment of universal access to healthcare. So these are just some of the other applicable legislations that you can apply.